friends, I am Savan, and today we'll be discussing further the pharmacology of the autonomic nervous system. And today our topic will be clinical relevance of indirect cholinomimetics. पहली बात, we'll try to understand what is indirect cholinomimetics agents. So जैसे कि we all know that this is the synaptic cleft and this is a presynaptic neuron. Okay, so this is a presynaptic neuron, this is synaptic cleft, and this is an effector organ where the effect will be produced of the acetylcholine. So we know the parasympathetic neurons, they produce acetylcholine. So acetylcholine is released in the synaptic cleft, yeah, and there is a very special enzyme present within the synaptic cleft that is called as ACE. ACE means acetylcholinesterases. This enzyme is responsible for destruction of the acetylcholine after it has completed its work. You know, some of the acetylcholine binds here, and in a little bit of time, when the effect is produced, to minimize or to minimize and to ensure that the acetylcholine don't stimulate these receptor unduly, unnecessarily a lot. So what does this enzyme do? This enzyme destroy the acetylcholine in the cleft. Okay, so indirect cholinomimetics kya hai? It is based on the principle that if any molecule or any drug that can inhibit this enzyme, it will lead to what? It will lead to the increase in the production of, or increase in the level of acetylcholine in the synaptic cleft. Why the level will be increased? Because level इसलिए increase हुआ because the acetylcholine that is present is not destroyed by this enzyme. So indirect cholinomimetic agents, they work by destroying the acetylcholinesterase enzyme that is present in the synaptic cleft, and thus increasing the level of acetylcholine within the synaptic cleft. And increased level of acetylcholine can produce the effects by acting on various type of receptor, that can be muscarinic receptor or the nicotinic receptor, depends on where it is acting. Okay, so I like to introduce two group of drugs. Okay, first group is the short acting drug. Short acting drug of indirect cholinomimetic short acting is endrophonium. Endrophonium itna short acting hai that its action of duration is just 10 minutes. So what can you just get in the 10 minutes, hai na? Because it is a water soluble drug, remember it. Okay, and then we have the medium acting agents. Medium acting agents include the neostigmine, pyridostigmine and the physostigmine. So two group of agents are there. Okay, so we can group these agents based on their solubility, because अगर agent lipid soluble है या water soluble है, so based on their solubility the route of administration of the drug will be different. ठीक है, so you should remember the endrophonium because it has O and O is also there in H2O. Okay, so endrophonium, you can remember it is a water soluble drug. So can the water soluble drug be orally given to the patient? The answer is no, because the mucosal lining of the GIT from where the drug has to be absorbed, that mucosal lining is lipid. Yeah, it is made up of lipids, the cells. So this drug should not be given, the endrophonium or any water soluble drug, we should not give that drug orally. Okay, and the other property of the water soluble drug will be what? It will not produce any central effect. Central effect means the effects on brain. Why? Because हमें पता है that the brain have a blood brain barrier. Yes, and blood brain barrier can only be crossed by the substance that are very small in size and that have very high lipid solubility. The water soluble compounds cannot cross the blood brain barrier. So you should remember the drugs that are water soluble, they are to be administered intravenously or parenterally, that is they cannot be taken orally. So endrophonium should only be given by injection. Okay, the other type of example of water soluble drug is neostigmine. Again, O is there in the water also, so means it is water soluble. And the example of a lipid soluble drug that I like to give is physostigmine. Here the O is not for the water. physio, you can remember physiology, we read a lot about lipids. So physiostigmine is a lipid soluble compound. Lipid soluble agar drug hai, so what can be the route of administration of that drug? Any drug that is lipid soluble can be given orally. Yes, because it will be well absorbed through the GIT, and it will be then distributed throughout the body through blood circulation. And the other effect that this drug can produce is that this drug can penetrate the CNS. It can have the central effects, ठीक है, because it is very lipid soluble and cross the blood-brain barrier, ठीक है. So let us now understand. After this principle has been summarized by me, let us now understand what are the uses. Where can we use indirect cholinomimetics? पहली बात, हम बात करते हैं एंड्रोफोनियम. एंड्रोफोनियम, it is like a phone, missed call. Missed call is of very short duration, so you should remember the missed call, the phone is just the duration of action of this drug is 10 minutes. 10 minutes का मतलब है that maybe this drug can be used for testing something. Yeah, I'll explain you. But this drug is used for the confirming of diagnosis of Myasthenia Gravis. In Myasthenia Gravis, it is a disease. It is an autoimmune disease. जिसमें you have produced antibodies against the nicotinic receptor present on the skeletal muscles. So the nicotinic receptor that are present on the skeletal muscle, they are being destroyed. और अगर nicotinic receptor destroy हो गए हैं, so can the acetylcholine act on the nicotinic receptors? No. So what will happen? The muscle weakness will be produced. The patient will lack the contraction of the muscle. Yes, so muscle will become weak. तो for example, आपके पास कोई patient आता है and you are suspecting that the patient has myasthenia gravis. So how can you confirm this diagnosis? You can administer a shot of एंड्रोफोनियम टू दैट पेशेंट IV intravenously, and एंड्रोफोनियम हमें पता है indirect cholinomimetic है, so it will increase the level of acetylcholine, and the level of acetylcholine will be more in the cleft, and thus one injection of eindrophonium will result into improvement in the patient condition. The muscle weakness will disappear and muscle contraction may start. So this drug can be used for confirming the diagnosis of the Myasthenia Gravis, and it is water soluble, so it can be given intravenously and it will increase the muscle strength if the patient has Myasthenia Gravis. But you should be very much sure about your diagnosis of Myasthenia Gravis, because agar your patient is not having Myasthenia Gravis and you are giving this eindrophonium to that patient, it can deteriorate the condition of the patient, because this drug will activate the M-cholinergic receptors and the nicotinic receptors, so it will produce contraction of the muscle, and it will produce diarrhea, it can produce vomiting, it can produce meiosis, it can produce near vision accommodation, it can produce urination. So various type of bad effects will be produced if you are not confirmed about your diagnosis, and if you give this short acting phone missed call drug to your patient, that is एंड्रोफोनियम. तो नेक्स्ट ड्रग हम जिसकी बात करेंगे, so this is done, and next drug we are going to see is the physiostigmine. I just tell you physio, you can remember physiology, you read about lipids. So this is a lipid soluble drug. So route of administration is what? Oral. Okay, oral route of administration, it will distribute throughout your body and will give various type of effects, because lipid soluble होने की वजह से it will act on the central nervous system also. It can act on the peripheral organs of the body, that is GIT, eyes, bladder, many organs in which the receptors are present, M receptors and the N receptors. ठीक है, तो where can this drug be used? Physiostigmine. So most of you will say that this drug can be used in the treatment of Alzheimer's disease. Alzheimer's disease में क्या होता है? There is destruction of the cholinergic neurons in your central nervous system, and destruction की वजह से there are low level of acetylcholine in your central nervous system. So आपने सही सोचा है that you may administer this drug physiostigmine, because indirect cholinomimetic, it will increase the level of acetylcholine in your central nervous system. okay, your approach is good, you can give this lipid soluble drug for the treatment of Alzheimer's disease. It is okay, perfectly okay. But have you ever thought about the side effect of this drug? You are treating the patient with for the Alzheimer's disease, but this drug, because it can bind to all the receptor M1, M2, M3, M4 nicotinic receptors that are present elsewhere in the body also. So this drug can produce various blunderous and even dangerous side effects. So the patient with the Alzheimer's disease is there, and he is passing the urine, he is having the diarrhea, he is vomiting, and he's having the bradycardia, he is having difficulty in breathing because of this drug. So the side effects that are produced by this drug will what we say, the side effects will be more, and uska effects bhi utna nahi hai. The therapeutic effect is very less than the side effect of this drug because of its peripheral effects. So say no to physiostigmine, no to the physiostigmine for the treatment of the Alzheimer's disease. If anybody asks you why, you should say that it has lot of peripheral effects for the treatment of Alzheimer's disease. तो हम इस ड्रग को जो फिजियोस्टिग्मिन है हम यूज कहाँ कर सकते हैं? Where can this drug be used? This drug can be used for the treatment of atropine poisoning. Atropine, we'll read it in other chapters, that atropine जो है, I'll explain you in short. Atropine can bind to the cholinereceptors. That is, it can bind to the N-cholinereceptors and it can bind to the M-cholinereceptors, and thus it can give the effects that you don't want. It can produce poisoning. For example, if it is binding to the M-cholinereceptors, okay, in various parts of your body, M-cholinereceptor, if it's binding in for example GIT, so what will it cause? It will cause constipation. Yes, if it binds to the M-cholinereceptor in your heart, it can cause what? Sympathetic activity of your heartbeat can increase a lot. So atropine can have deleterious effects on your body, and to tackle this you should give what? Physiostigmine. Physiostigmine क्या करेगी? It is indirect cholinomimetic drug, and it will increase the concentration of acetylcholine in the synaptic cleft, and due to increase in concentration of acetylcholine in the synaptic cleft, it will competitively bind for the receptor with for the receptor for atropine. Okay, so it will compete with atropine for the muscarinic or the nicotinic receptors that are there. Okay, so application of physiostigmine is your atropine poisoning. Okay, and then we have other drug that is called as Alzheimer's disease. I just told you that you cannot use the physiostigmine, but I didn't tell you the other drugs that can be used. The other drugs that can be used for the Alzheimer's disease is tacrine, donepezil, and rivastigmine. Stigmine, riva and the stigmine, galenta and the galentamide, riva and the stigmine, rivastigmine, galenta and the galentamide, donepezil and the tacrine. ये 4 ड्रग्स आप Alzheimer's disease के लिए you can use, but remember, tacrine was drug of choice earlier, but now we are not using tacrine because it has high hepatotoxic potential. It can cause damaging effects on your liver. So now the famous drug of use for Alzheimer's disease is what? Donepezil, rivastigmine and the galentamide. Okay, so will it prevent Alzheimer's disease? No, it can't prevent, because in Alzheimer's disease there is destruction of cholinergic neurons. Yeah, it will delay the progression of Alzheimer's disease, but it won't prevent, it won't cure the Alzheimer's disease. Okay, now we come to the drug that is pyridostigmine and the neostigmine. Neostigmine and the pyridostigmine, we know we are giving the neostigmine the shot of the neostigmine because it is water soluble, and pyridostigmine can be given orally also, and it is used for the treatment of Myasthenia Gravis. Myasthenia Gravis हमको पता है, it is a condition in which autoantibodies are produced against the nicotinic receptor present on the skeletal muscles. So these autoantibodies are destroying the nicotinic receptors and there is already less amount of acetylcholine in the cleft. So what is the principle is that you want to increase the amount of acetylcholine in the cleft, so that the more acetylcholine can act on the receptor, nicotinic M type receptor that is present on skeletal muscle. Therefore it will help to delay the progression of the myasthenia gravis. So these are the important drugs. Other मैं बात करना चाहूँगा very important group of drugs, that is the poisoning of organophosphates. Organophosphates हमें पता है they are mostly the compounds that are used in the agricultural industries, and farmers are using and throwing the pesticides on crops, and these pesticides, these are organophosphate compounds. So you should remember the organophosphate compounds, what do? They can irreversibly inhibit ACE. It will irreversibly inhibit this enzyme, that is acetylcholinesterase. The drugs we were using, they inhibited this enzyme, but it was for a duration of time. Irreversible inhibition का मतलब आप समझते हैं that there is no cholinergic activity taking place in your central nervous system, no cholinergic activity taking place in your organs. So the patient with the organophosphate poisoning, he will develop what we call as the symptoms that includes start from up to down. So the patient who have by mistakenly taken some organophosphate, he will present with vomiting, he will present with meiosis, he will present with the accommodation for the near vision, he will present with breathing problem, because M2 type of receptor are present on your lungs, and it causes your lungs to be dilated or constricted. Okay, so this is what happens, and it will produce diarrhea, it will produce urinary output, it will produce breathing problem, that is bronchoconstriction, and it will produce bradycardia, and it will produce the hypotension, because the heart is not pumping the blood well to the organs. So such patient can die in couple of minutes. So if he is brought to the hospital within the time, within what we say 30 minutes, if you give the antidote for the organophosphates, that is PAM, 2PAM, pralidoxime. This is the antidote for the organophosphate poisoning. How does this pralidoxime helps is that it reactivates the acetylcholinesterases, and the reactivation of acetylcholinesterases will reverse all these symptoms of poisoning that were produced. So but the only thing is that the time is very important. If the patient has not been brought to hospital and it has been 1 hour or 2 hours, so there is very less chance of survival of patient, because he may die of asphyxia, or he may have died of low blood pressure and the other symptoms of cholinergic activation. So, and thanks for this listening to my video, and keep subscribing and liking the channel for more videos. Thank you everybody.